For the love of God, Doc, he's drowning in his own blood, do something. The words were a ragged snarl ripped from the throat of Senior Chief Reaper Stone, a man carved from granite and gunpowder. His face, smeared with camo paint and grit, was a mask of fury just inches from mine. Above us, the indifferent peaks of the Hindu Kush clawed at a steel-gray sky, and the air was thin, cold, and filled with the percussive rhythm of death. Gunfire a constant, angry chatter that echoed in the canyons around us. "I'm trying, Senior Chief," I yelled back, my voice strained, my fingers slick with blood that was to warm against the biting wind. My patient, our team leader, Lieutenant Commander Aries Thorne, was dying. He was laid out behind a pathetic excuse for Covera cluster of jagged Rakshas Chester ruin. A heavy machine gun round had torn through his side, just below the armpit, shattering ribs and turning his lung into a shredded mess. Every ragged breath he took was a wet, gurgling sound, a sound I knew all too well. Tension pneumothorax and massive internal hemorrhaging. I'd already inserted a needle into his chest to release the trapped air, a textbook move. But it wasn't enough. The bleeding was too fast, too deep. His blood pressure was cratering. His pulse, a frantic, thready beat under my fingertips, was getting weaker by the second. "He's got minutes, maybe," I shouted over the din of battle, my mind racing faster than the bullets whizzing past our heads. "The medevac is 20 minutes out. He won't make it." Reaper grabbed the front of my plate carrier, his knuckles white. "Then make him make it, Doc. That's your only job." His real name was Leo Evans, but in the teams, I was just Doc, a 28-year-old Special Operations Combat medic, a glorified corpsman with a few extra schools under my belt. To a man like Reaper, a 20-year veteran who'd seen hell and spit in its eye, I was just a kid playing doctor. A kid who was about to watch his lieutenant die. I looked at Thorne. His eyes, usually a sharp, intelligent blue, were hazy, distant. His lips were turning blue. The signs were all there. He was checking out. We were losing him. And in that moment, a ghost from my past whispered in my ear. A voice I had spent 10 years trying to escape, my father's voice. "When the textbooks fail you, son, you have to improvise. You have to be bold. Hesitation is the enemy of life." A wild, insane idea began to form in the chaos of my mind. A procedure so far outside my scope of practice, so far beyond what any corpsman should ever attempt in the field, that it was tantamount to a death sentence in itself. I locked eyes with Reaper. His were filled with desperate rage. Mine must have looked like madness. "I'm going in," I said, my voice eerily calm. Reaper's face contorted in confusion. "Going in where? We're pinned down." "No," I said, pulling my trauma shears and a scalpel from my kit. "I'm going inside his chest." For a second, the gunfire seemed to fade away. There was only the wind and the incredulous, horrified stare of Senior Chief Reaper Stone. "What did you just say?" he breathed, the words barely audible. "I'm going to open his chest," I repeated, my hands already moving, prepping the area with an alcohol wipe, the cold stinging Thorne skin. "I'm going to clamp the artery myself. It's the only chance he has." Reaper stared at me, as if I'd just grown a second head. Then, his disbelief curdled into pure, unadulterated fury. He shoved me back, hard. "Have you lost your goddamn mind, Evans?" he roared, his voice cracking with a mix of anger and fear. "You're a corpsman, not a goddamn surgeon. You'll kill him. You'll murder him right here on this rock. He's already dead if I do nothing." I shot back, pushing forward again, shielding Thorne's body with my own as a fresh volley of fire kicked up dust and rock chips around us. "His pressure is gone. He has no pulse in his wrist. We have maybe 90 seconds of viable brain function left. This isn't a choice anymore, Senior Chief. It's a coin toss in a hurricane, and this is the only coin I have left to flip." Two other members of our team, Ghost and Rook, were laying down, suppressing fire, their rifles barking in a steady, controlled rhythm. They glanced back, their eyes wide behind their ballistic glasses, catching the tail end of our argument. "What's the play, Doc?" Ghost yelled, reloading with practiced efficiency. "I'm cracking his chest." The firing from Ghost's position faltered for a half second. "You're what?" "It's called a field thoracotomy," I snapped, my focus narrowing, the world shrinking to the few square inches of Thorne's torso. "He's bleeding out from the subclavian artery. I can feel the hematoma growing. If I don't stop it now, he's gone." Reaper grabbed my arm, his grip like a vice. I am ordering you to stand down, petty officer. That is a direct order. You will continue standard care until the bird arrives. Do you understand me? I looked from Reaper's enraged face to Thorn's pale, still one. I saw my father, standing over a surgical table, his eyes cold and disappointed. I saw my sister in a hospital bed, her life slipping away while doctors spoke in hushed, helpless tones. The helplessness that was the feeling I had sworn I would never feel again. I met Reaper's glare, for the first time in my 3 years on the team. I wasn't just Doc, the junior guy. I was the senior medical authority on site. And in a medical situation, my word was law, even over a senior chief. Negative, senior chief, I said, my voice as cold and hard as the steel of my scalpel. In this, I outrank you. Ghost, Rook, I need you to build a wall in front of me. Give me 5 minutes. 5 minutes of absolute cover. Do not let anything get through. There was a beat of silence, broken only by the wind and the distant echo of enemy fire. It was a moment of mutiny or salvation. Ghost and Rook exchanged a look. They had known Reaper for a decade. They had known me for 3 years, but they had also seen me work. They had seen me pull guys back from the brink before. Finally, Ghost gave a sharp nod. You got it, Doc. 5 minutes, make it count. He and Rook repositioned themselves, their bodies forming a human shield, their rifles becoming an extension of their will. They began firing with a new, furious intensity, a wall of lead and fury directed at the unseen enemy on the ridge above. Reaper stared at me, his face a thundercloud of disbelief and betrayal. Evans, if he dies, I will personally see you court-martialed and thrown in prison for the rest of your life. I didn't look at him. My eyes were on my patient. Get on the horn with the bird, I said, my voice flat, devoid of emotion. Tell them to have a trauma surgeon and a full thoracic kit ready on the deck the second they land. Tell them to prep for a massive transfusion. And tell them their patient is coming in with his chest open. Then, with a deep breath that barely filled my own oxygen-starved lungs, I made the first cut. The scalpel slid through skin and muscle, and the warm, dark blood began to well up immediately. There was no turning back now. The next 5 minutes were a symphony from hell. The staccato beat of rifles, the angry buzz of ricochets, the grunts and curses of my teammates, it all became background noise. My world was a red, wet, and terrifyingly complex landscape of human anatomy, illuminated by the cold, unforgiving mountain light. My hands, miraculously, were steady. The training my father had forced on me as a teenager, suturing pig's feet, studying anatomical charts until I could see them in my sleep, it all came flooding back. Not as hated lessons from a man I could never please, but as pure, instinctual muscle memory. Rib spreader, I muttered to myself, realizing I didn't have one. Improvising, I used the handles of 2 Kelly clamps, jamming them between the severed ribs and cranking them open. The grating sound of bone and cartilage was sickening, but it gave me the window I needed. Inside it was chaos. The lung, collapsed and bruised, looked like a purple sponge. And beneath it, a torrent of blood was pulsing from a tear in the massive subclavian artery, the main vessel that fed the arm. Thorn's life was pouring out into his chest cavity. Suction, I whispered, again to no one. I had no suction. I used gauze, my gloved hands, anything to clear the blood so I could see. The cold was a problem. My fingers were getting numb. Thorn's core temperature was dropping dangerously low. 30 seconds, Doc, Ghost yelled. I found the tear. It was ugly, jagged, my target. With one hand, I pushed the lung aside. With the other, I guided a long hemostat deep into the wound. The angle was all wrong. I couldn't get the right purchase. Blood kept obscuring my view. Come on, Leo, come on. My father's voice again, this time from a memory of him guiding my clumsy teenage hands. Feel, don't just look. Anatomy is a roadmap you should know by touch. I closed my eyes for a fraction of a second. I pictured the charts. The artery, the vein, the nerve bundle. I visualized it. Then I opened my eyes and went in again, this time by feel. My fingers traced the vessel up towards the collarbone, past the tear. I felt the pulse, weak but still there. I slid the hemostat around it. Click! The clamp locked into place. The torrential pulsing of blood slowed, then stopped. It was replaced by a slow, steady ooze from the surrounding tissue damage. But the main leak, the one that was killing him, was plugged. He's stabilizing my breath, watching the makeshift monitor I had attached to his finger. His oxygen saturation, which had been in the low 70s, flickered and began to climb. 80, 82, 85. Bird is 1 minute out. Reaper's voice, tight with tension. I worked frantically, packing the chest cavity with gauze, trying to keep everything as clean as possible in this filthy environment. I couldn't close him up. That was a job for a real surgeon in a sterile operating room. I just had to keep him alive until he got there. The thumping WHUMP hump of the Black Hawk's rotors grew louder, beating against the mountainside, kicking up a storm of dust and loose snow. The helicopter settled into a precarious hover just yards away, its side door open, a flight medic ready with a litter. "Let's go! Let's go!" Ghost and Rook laid down a final, deafening volley of fire as Reaper and I carefully lifted Thorn onto the litter. I held the chest clamps and for lines, my body shielding the open wound from the rotor wash. We scrambled towards the helicopter, the noise and wind of physical force pushing against us. As we loaded him in, the flight medic's eyes went wide, staring at the gaping, clamped wound in Thorn's chest. "What in God's name?" he started. "Just keep him warm and keep the blood coming." I yelled over the rotors. "He's clamped high on the left subclavian. Tell the surgeon at Bagram." I was about to climb in with him, but Reaper grabbed my shoulder and hauled me back. "Your job is done, Doc. Get back in the fight." There was no time to argue. The Black Hawk lifted away, a fragile bubble of hope against the vast, hostile landscape. I watched it go, my heart pounding in my throat, my hands and arms painted red to the elbows. We were still in a firefight. We were still miles from safety. And I had just performed a procedure that would either be hailed as a miracle or prosecuted as a homicide. I turned back to the rocks, grabbed my rifle, and chambered around. My hands were shaking now, the adrenaline dump hitting me like a freight train. Reaper was beside me, his eyes unreadable. He didn't say a word. He just handed me a fresh magazine, and together, we returned to the grim business of survival. The question of whether I had just saved my lieutenant's life or merely delayed his death would have to wait. The flight to Bagram Airfield was a blur of controlled chaos. The return to our forward operating base was a silent, somber affair. The hours after were a slow-motion nightmare of debriefings, gear maintenance, and the gnawing, corrosive uncertainty that eats away at a soldier's soul. No one spoke about what happened on the mountain, least of all, me and Reaper. An invisible wall of protocol and judgment now stood between us. He looked at me, but his eyes were shuttered. He saw a liability, a loose cannon who had broken every rule in the book. The official word came down 12 hours later. Thorn had survived the flight. He'd survived a marathon surgery at Bagram, where a team of surgeons, working frantically, had managed to repair the artery and control the bleeding. He was alive. But he was in a medically induced coma. His condition listed as extremely critical. He was being prepped for immediate transport to the Landstuhl Regional Medical Center in Germany, the largest American hospital outside the United States. A small measure of relief washed over me, but it was quickly replaced by a cold dread. Now that the immediate danger was over, the consequences of my actions would begin. And they began with a summons. 2 days later, I was standing at attention in a makeshift office, facing a man I had never seen before. A colonel from the Special Operations Command's Medical Directorate. He had a file in his hands. My file. "Petty Officer Evans," he said, his voice flat. "I've read the after-action report. I've read Senior Chief Stone's sworn statement. And I've read the preliminary report from the surgical team at Bagram." He paused, letting the silence stretch. "Explain to me in your own words why you thought you were qualified to perform a resuscitative thoracotomy with no sterile equipment, no surgical assistance, and no direct oversight, in the middle of a firefight." I kept my eyes fixed on a point on the wall behind him. "Sir, the patient was an extremis. He had a non-compressible torso hemorrhage. Standard protocols were failing. Without immediate intervention to control the source of the bleed, he would have expired before medevac arrived. It was my assessment that the procedure, while unorthodox and carrying extreme risk, represented the patient's only chance of survival." I had rehearsed those lines in my head 100 times, clinical, detached, by the book, even as I described throwing the book away. The colonel stared at me, his expression unchanging. "Your assessment. You do understand, petty officer, that your assessment falls wildly outside the scope of a special operations combat medic? You cracked a man's chest open with a pair of trauma shears and a number 10 blade. You are not a surgeon." "No, sir," I said. "I am not." "Then what, exactly, are you?" The question hung in the air. It was the same question I had been asking myself for years. I gave him the only answer I could. "I'm the medic assigned to his team. Sir, my job is to bring him home alive." The colonel closed the file. "Your actions are under official review at the highest levels of SOCOM. You are hereby confined to this base. You are not to participate in any further operations pending the outcome of this investigation. Dismissed." The investigation was happening a world away, in the sterile, brightly lit halls of Landstuhl. It was being led by Captain Eva Rostova, a Navy trauma surgeon with a reputation as fierce as her scalpel. She was a legend in military medicine, a woman who had pioneered new techniques for damage control surgery in the crucible of Iraq and Afghanistan. When she walked into an operating room, generals fell silent. She now stood in front of a series of large, backlit screens, displaying the CT scans of Lieutenant Commander Thorne's chest. The images were brutal. Shattered ribs, a bruised lung, and the clear, miraculous evidence of a hemostat clamped perfectly on the shredded subclavian artery. "Tell me again," she said, her voice quiet but carrying an edge of tempered steel. She was addressing a group of surgeons, all of whom outranked her in years, but not in expertise. "This clamp was placed in the field?" "Yes, Captain," a major answered nervously. The Bagram team confirmed it. It was still in place when they opened him up. They said whoever put it there saved his life. The placement was perfect, another millimeter either way, and he would have bled out from a collateral artery or suffered irreversible nerve damage. Rostova traced the image on the screen with her finger. Perfect placement, in the cold, under fire. With no light source but the sun, by a corpsman, she turned to face the room. "Does anyone here find that story even remotely plausible?" Silence. "Because I don't," she continued, her eyes sweeping over the assembled doctors. "I've trained hundreds of surgeons. I've seen the best work under pressure. And I can tell you, without a shadow of a doubt, that what I'm looking at right here, this isn't the work of a medic. This is the work of a highly skilled, experienced cardiothoracic surgeon. So, I'll ask again, who did this?" The major cleared his throat. "The report says it was his team's SOIDC, a Petty Officer Leo Evans." Rostova's eyes narrowed. "Pull up Petty Officer Evans's file. I want to see every school he's ever attended, every certification he's ever earned. I want to know who trained him. And I want to see 17 fueled and ready. I'm going to Afghanistan. I'm going to meet this miracle worker myself." 2 days later, the door to the office I was confined to opened, and Captain Rostova walked in. She was shorter than I expected, with sharp, intelligent eyes that seemed to see right through the uniform, right through the skin, and into the anatomy beneath. She didn't introduce herself. She didn't need to. She dropped a set of Thorne's chest scans onto the metal desk between us. The clatter was unnervingly loud in the small room. "I'm Captain Rostova," she said, her voice crisp and devoid of pleasantries. "Walk me through the procedure." For the next hour, she interrogated me. It wasn't an investigation, it was a surgical peer review. She didn't ask about protocol or orders. She asked about my incision point, my method for rib retraction, my technique for locating the artery by feel, my choice of clamp. Her questions were precise, relentless, and aimed at one thing: finding the flaw in my story. She expected to find a lucky guesser, a reckless amateur who got lucky. But I had the answers. I described the feel of the fascial planes, the specific texture of the arterial wall versus the surrounding tissue, the subtle change in blood flow I felt once the clamp was seated. I used terminology that a corpsman had no business knowing. As I spoke, her expression slowly changed from skepticism to a deep, unnerving curiosity. She was no longer looking at a rule-breaking sailor. She was looking at a medical anomaly. Finally, she leaned back, crossing her arms. "I've reviewed your file, Evans. Naval Special Warfare Medic Course, Advanced Tactical Practitioner. Some of the best training in the world, for what it is. But nothing in here, nothing explains how you knew how to do that. Where did you learn it?" The question I had been dreading. The one that would force me to open a door I had nailed shut a decade ago. I stared at the scans on the table, at the image of the clamp that had saved Thorne's life. "My father," I said, the words tasting like ash. "My father taught me." Rostova's brow furrowed slightly. Your father was a surgeon? I let out a short, bitter laugh. My father wasn't a surgeon, Captain. My father is Dr. Julian Evans. The name landed in the room with a physical weight. Rostova's eyes widened almost imperceptibly. There wasn't a surgeon in the Western world who didn't know the name Julian Evans. He was a god in the world of cardiothoracic surgery, a pioneer, an innovator, a genius, and a notoriously cold, demanding, and brilliant bastard. Julian Evans is your father, she said slowly, re-evaluating everything she thought she knew about me. He wanted a protege, I explained, my voice hollow as I dredged up the memories, an heir to his throne. From the time I was 10, my life wasn't my own, it was pre-med. Summer vacations weren't for baseball, they were for anatomy labs. After school hours weren't for friends. They were for practicing sutures on pig's feet in his home office until my hands bled. I looked up, meeting her intense gaze. He didn't teach me medicine, Captain, he drilled it into me. He force-fed me knowledge until I was choking on it. He saw patients as complex puzzles, not people, and he saw me as his greatest project. So you joined the Navy to get away from him, she concluded, understanding dawning in her eyes. I joined the SEAL teams. It was the one place on Earth he couldn't follow me. The one thing I could do that he would never understand or respect. I wanted to be a warrior, not a technician in a white coat. We sat in silence for a long moment. The hum of the base's generator seemed to amplify the tension. There's more, isn't there? Rostova said softly. It wasn't a question. Something happened. I swallowed hard, the memory rising up, sharp and painful as a shard of glass in my throat. My sister, my younger sister, Chloe, she was everything to me. The only one who saw me as Leo, not the surgeon's son. My voice started to shake, and I fought to control it. When I was 18, she was in a car accident. A drunk driver, I was the first one on the scene. I was on my way to pick her up. The images flooded my mind. The twisted metal, the smell of gasoline. Her, trapped in the passenger seat, conscious but scared. She had internal injuries. I knew it. I could see the signs. The rapid, shallow breathing, the abdominal rigidity. All the things my father had drilled into me, but I didn't know what to do. I was just a kid. I held her hand and told her it would be okay. I just froze. I was helpless. A single tear traced a path through the dust on my cheek. I didn't bother to wipe it away. She died in the ambulance on the way to the hospital. She bled out internally. And all that knowledge, all that training my father gave me, it was useless. I couldn't save the one person who mattered. I finally looked at Rostova. Her expression was no longer one of a clinical investigator. It was one of profound, human understanding. That's why you joined, isn't it? She said, not just to run away from your father, but to run towards something else, to make sure you were never helpless again. I nodded, unable to speak. You didn't just save Lieutenant Commander Thorin's life, petty officer, she said, her voice softer now. You saved him with a ghost looking over your shoulder. You used your father's knowledge, but you did it with a warrior's heart. You did what you had to do because someone's life was on the line. That's the definition of a doctor, the best kind. She stood up and gathered the scans from the table. My report will reflect the context of your actions. It will state that, while your procedure was unprecedented, it was also medically sound and directly responsible for saving the life of a fellow operator. It was, in my official opinion, a heroic act. She walked to the door, then paused and looked back at me. Your father gave you a gift, Evans, a terrible, burdensome gift. But you just learned how to make it your own. Don't ever run from it again. Then she was gone, leaving me alone with the ghost of my past and the first glimmer of a future I had never thought possible. The ripples from Captain Rostova's report spread quickly through the command structure. The word court-martial was replaced with commendation. The official review was closed. I was no longer a pariah, but a reluctant hero. The confinement was lifted, but the hardest conversation was yet to come. I found Reaper Stone by the armory, meticulously cleaning his rifle. He didn't look up as I approached. The silence between us was heavier than any body armor. Senior Chief, I started, my voice quiet. He continued working, his movements precise and economical. Evans, I just want you to say, I struggled for the words. There was no protocol for this. He finally stopped, setting down a cleaning rod. He looked up at me, his eyes tired but clear. "Save it, Doc. You don't need to say anything." He stood up, wiping his hands on a rag. He was still an intimidating presence, a man who seemed to take up more space than his frame suggested. "I was there," he said, his voice a low gravelly rumble. "I saw what you did. I've been in this business for 20 years. I've seen men die from less. I've seen surgeons in a hospital lose patients with injuries like that." He took a step closer, his gaze unwavering. "I was wrong. I let my experience blind me. I saw a kid, and I saw a rule book being torn up. I didn't see the man who was about to pull off a 1-in-a-million shot. What you did up there, it wasn't in any book, it was something else." He stuck out a calloused hand. "You saved my lieutenant, you saved my brother. There's no debt I can ever repay for that." I shook his hand. The grip was firm, a silent acknowledgement of a bond forged in blood and fire. The wall between us was gone. In its place was a foundation of respect, hard-earned and absolute. A week later, I was allowed to make a video call to Landstuhl. On the screen, Thorn appeared. He was pale, thinner, and sitting up in a hospital bed with a web of tubes and wires still attached to him, but he was awake, and he was smiling. "Hey, Doc," he said, his voice weak but clear. "Sir," I said, a wave of genuine relief so powerful it almost buckled my knees washing over me. "It's good to see you." "It's good to be seen," he countered with a weak chuckle. They told me what you did. Open me up like a can of sardines on the side of a mountain." "Something like that, sir." He shook his head slowly, his smile fading into something more serious, more profound. "Leo, they told me there was no chance. The surgeons here, Rostova, they said you did the impossible. They said you gave me back my life." He looked straight into the camera, his blue eyes locking onto mine. "How do I thank a man for that?" "Just get better, sir," I said, my throat tight. "Just come home." "I will," he promised. "And when I do, you and I are going to have a long talk about your future." That talk happened 3 months later. Thorn, against all odds, was on the road to a full recovery. He'd lost some function in his left arm, but with intensive physical therapy, he was expected to regain most of it. He would never operate at the tip of the spear again, but he was alive, and he was still a leader. He found me on the beach at Coronado, after a training exercise. The California sun felt a world away from the freezing peaks of the Hindu Kush. "Walk with me, Doc," he said. He moved with a slight stiffness, but the strength was returning to him. We walked along the shoreline, the waves crashing rhythmically against the sand. "Rostova told me everything," he began. "About your father, about your sister, about why you're really here." I didn't say anything. I just kept walking, my eyes on the horizon. "For 10 years, you've been running from your destiny," he said. "You have a gift, Leo, a gift to heal. You tried to bury it under camo paint and a rifle, but it was always there. And when it mattered most, it saved my life." He stopped and turned to face me. "SOCOM has a program. The Inter-Service Physician Assistant Program. But for you, they're willing to make an exception, a direct path. They'll send you to medical school, the Uniformed Services University. You can become a full-fledged Navy surgeon. You can come back and serve the teams as a doctor. The kind of doctor who understands what we go through because he's been there himself." He paused, letting the weight of the offer sink in. "It's time to stop running, Leo. It's time to embrace who you are. All of it, the warrior and the healer." I looked out at the ocean, at the vast, endless expanse of blue. For the first time, I didn't feel like I was running from my past. I felt like I was finally facing my future. The knowledge my father had given me was no longer a curse. My sister's memory was no longer just a source of pain. It was a source of purpose, and the SEAL teams, they weren't an escape. They were my family. They had shown me how to temper knowledge with courage, how to turn skill into service. I had spent my whole life caught between two worlds. The sterile, intellectual world of surgery, and the violent, visceral world of a warrior. I finally realized I didn't have to choose. I could be both. I turned back to Thorn, my commander, my patient, my friend. And for the first time in a long, long time, I felt a sense of peace. "Okay," I said, "I'll do it. The story of what happened on that mountain became a quiet legend within the teams, a testament to what can happen when desperation meets extraordinary, hidden talent. But the real lesson wasn't about the impossible surgery or the heroic act. It was about the journey of a man who finally learned that the things we run from are often the very things that define our greatest strengths. True courage isn't about ignoring your ghosts. It's about learning to walk with them, to let them guide you toward the person you were always meant to be. My path was never going to be my father's, but I would take the gifts he gave me, and I would use them to serve the brothers who stood by my side in the darkest of places. I would be their doc, their surgeon, their brother always. This story teaches us a powerful lesson. Sometimes, the skills we resent, the burdens we carry from our past can become our greatest assets when it matters most. It's about not running from who you are, but integrating every part of your experience to serve a higher purpose. What about you? Is there a part of your past, a skill you learned, or an experience you had that you've tried to leave behind, but might actually be one of your greatest strengths? Let me know your story in the comments below. Your journey could inspire someone else to see their own past in a new light. And if this story of courage and redemption resonated with you, please hit that like button, share it with someone who needs to hear it, and subscribe for more stories about the quiet heroes who walk among us. Your support helps us bring these incredible journeys to light. Thank you for watching.